Everybody, I'm alive. I'm alive. I have survived my first week with my new hip and it's it's crazy. I anticipated a lot. I wrote a blog post about anticipating yesterday and I felt like I felt so prepared for this. I and there's many ways that I am. Like 2.5 years strength training totally prepared my upper body, my core to just be able to transfer myself from like a chair to a bed. It's so hard. And so I'm grateful that I have a very strong right leg to kind of push me up. And I'm grateful that I have strong arms and a strong core. And so that kind of stuff, just learning it the first week, this left leg that just doesn't want to move. Like it's so crazy how your brain's telling your leg to do something that it just won't move. So every day there's a little bit more progress as far as transferring from bed to standing or from a chair to standing. I took a walk yesterday just around my cul-de-sac. It's maybe 100 feet, 200 feet. It was exhausting. It's humbling. It's humbling. So the things I didn't anticipate, nobody told me this. Like I knew I would have to have, like I know the precautions. When you have a hip replacement, there's certain things. I had posterior hip replacement, which has some different precautions than an anterior hip replacement. And so there's no 90-degree bending. So sitting in a chair, you kind of have to be leaned back. I'm standing right now because I don't have a chair that I can sit on and kind of lean. So you can't be past 90 degrees. So your torso and your legs can't ever go this way. So I'm kind of always in this position. And then, so there's no bending over to pick up stuff. You have to have a little grabber, which is kind of fun, learning how to grab things. So that 90-degree thing, handle that, no big deal. The internal rotation, that's the hard part. You cannot internally rotate your leg because you have a huge risk of dislocation. I'm at a higher risk for dislocation because of my autoimmune disease, because I have hypermobile joints, just something I have to be super careful. So since my first hip surgery in 2016, the way that I found comfort is internally rotating if this is my leg, I internally rotate that leg and I take my right leg on top of it to provide a little traction to get into that area of my hip that was so painful. So my brain still thinks hip hurts, internally rotate. So I have to think all the time when I'm sitting in a chair, not cross your legs, don't cross your legs. So bedtime is where there's the highest risk for dislocation because you're asleep, you don't realize what you're doing in your sleep. And so I have to sleep with this wedge, how big it is between my legs. So this goes about at my knee, and then my legs go in, and both legs are securely strapped with Velcro. Okay. So I'm sleeping on my back with my legs in the wedge, on my back with my legs in the wedge. It's unbelievable. The restraint that you feel, like you're completely flat. You can't elevate your legs. So my back doesn't like this. And this prevents that leg from internally rotating or worse, crossing. And this I will have to wear for 12 weeks. 12 weeks, that's 3 months. So that's been a challenge. I also have a history of blood clots. So I'm wearing these pumper things on my calves all night long that just provide this pumping air into my legs to prevent a blood clot. I also have to wear compression stockings, which feel like pantyhose, super tight, super itchy. So I'm layered up on my lower body with compression stockings, compression pumpy things, and then my wedge. So sleep is hard. I'm not a napper. I don't nap ever, but I've learned to nap. Like that's been something I'm doing. Like I'm napping every day. And that helps me catch up on my sleep that I'm not getting at night. Other than that, I hang out here in my office quite a bit. I do go downstairs to my living room where it's sunnier and warmer, but I have all my stuff here. I've got my snacks, my meds, lots of oils, just books, my stuff. So I spend a lot of time up here, which is fine. It's good. Um, Doing a little bit of chair yoga this morning. My back was really, really tight from sleeping on my back with the wedge and not getting good sleep. I can't move. So I can't sit up in bed because that's a 90-degree bend. So I can't adjust to this. So it's unbelievable the reliability you have on other people. It is unbelievable. So I did a little chair yoga, I did a little cat and cow just to kind of get some movement going back in my spine. I feel like a week I've been still. And so doing a little bit of side bend gets into that. All of these movements are fine for total hip replacement. Um, the thing that I'm having to focus on when I'm walking is my toes and my quad and my thigh want to internally rotate. So I'm having to be very mindful to not let that happen. And that's probably due to some muscular structure and compensation I've done over the last 7 years that my body wants to go that way. So, another thing I didn't anticipate, which is delaying my progress, is when the surgeon was implanting the implant into my sawed off femur, my femur fractured. So, the implant that he put in was not quite right. He didn't like the fit that it had. So when he was removing it, I got a hairline fracture in my femur. And um, don't discount the hairline thing. It hurts. It hurts a lot. And I have to use a walker or crutches for 6 weeks because I have a fracture in my femur. So what normally would be just weight bearing as tolerated has become 6 to 8 weeks of using a device so that I'm 50% on my left leg. So that's a bummer. It's a huge bummer. And yesterday I stood up and I felt a lot of pain in my legs. So I have to be really, really mindful of that. So that was not something that was anticipated. And the surgeon was just so sad. Just knowing my history and knowing what I've gone through with my hip, just to have this added complication sucks. But it is what it is. And there's nothing we can do but just baby it. So other than that, good. Everything's good. I'm eating. I'm trying to be creative. I'm trying to move my body as much as I can within limitations. I get exhausted so quickly. It's unbelievable. And just reading, some of the complications that come when you do have lupus, you heal much slower and you have a higher risk for blood clots and a higher risk for infection with a joint replacement. So I'm just allowing myself to be me and to be with the diagnoses and to be with the stuff and not pretend that it doesn't exist, but not dwell on what does exist and just try to make the best of every day. So today I'm going to do my taxes. Exciting. I'm going to get that rolling. I got a couple blog posts coming at me that just bubble up in my time of hanging out and being still. So that's about it. That's my update. I'm looking already into March and what might come for March as far as some virtual stuff, some in-person stuff. I just have to take it and see where I go. So I go back to the surgeon next week to re-x-ray the femur to see how the fracture's healing, make sure there's no changes to that, and then just progress. So that's all I got. That's all I got. But I do plan to get on a little bit more virtual stuff here in the next couple of weeks. But I'm going to give myself this week to deal with my healing process and my taxes. And the day before my surgery, my garage door completely buckled, like buckled. The machine broke, the rails broke, the door broke. So dealing with that and just being home, like I'm never home. So it's kind of good. The animals will not leave me alone. I've got a dog here, the cat's around. So got lots of nurses. I'm grateful for all the help and love and support that I've gotten. It's been tremendous. It's been beautiful to see how loved I am. And I am so grateful for that. So stay tuned. There's more. And wish me some goodness on that stinking little femur. So, all right, I'll see you soon.